Oh, I'm Doreen and I spent over 20 years heading up the Cancer Information and Support Service for the Cancer Council Victoria. I'm 80. Yesterday I turned 80. I think especially if you're older, and especially my age, nobody talked about sex. Health professionals don't realise they're asking people to come with questions that they would never even ask their best friend. And so we're trying to get them to come in and say to a doctor, come and ask them really intimate questions about intimate issues. Even I find things embarrassing. You know, like if I had an issue with my vulva, and as women get older, the vulva is an issue in many cases. And I think we get vulval cancer killing more women because women don't talk about it. And when they've got issues, they don't go to the doctor, say, I'm here to show you my vulva, can you have a look at it? The GP even, they all have a nurse practitioner at a GP's office. And I think if the nurse practitioner becomes friendly and can talk about things, that puts a lead into the GP. It may be more expensive, but you'll find the word gets around and more people will become your patient if you have a nurse practitioner interview them first. And have a form, you know, welcome to whatever the practice is. We're here to help you. What is your major issue? Please let us know so I can be prepared to talk about with you. And that gets people into the right frame of mind. When I first set up a Cancer Connect program, where somebody who was diagnosed with the cancer was dealing with it and was down the track, well, I connected them by telephone to someone who was newly diagnosed. You know, it just made such a difference. They were really honest. They talked about stuff that they wouldn't talk, say to me or to you, and yet they really helped each other. All my cancer nurses, I had to train them on how to hold a telephone conversation about intimate issues. They were fine with urinating, with bowel movements, but sexuality, you know, it's so funny, really. How to talk to people, how to listen, to wait. If you ask a question and there's a hesitancy, wait it out. Don't rush in, you know, and start filling in. A lot of the treatments really impacted on people's body image, any body part, not just sexuality, or, you know, if it's your face, you're missing a hand, whatever. And we just have to teach people that your love for who you are. The oncologists are fantastic. And I'd say to them, you can ask him anything, write it down if you don't want to say it. And that's one that helps. If they feel embarrassed bringing it up with the doctor, write it down. So I found once we started saying we've got a cancer helpline, they knew they could call and ask anything. And if you're embarrassed, you can ask somebody, a voice on the phone, you can ask them something you wouldn't ask face to face. And we'd say, ask your doctor this and this. Or they'd say, I'm taking such and such. And we'd say, has your doctor told you about the side effects? And then we'd send out brochures and things and say, you can call us anytime. If somebody's there when you've lost your teeth and, you know, you've got one breast, or else you've had prostate or bowel cancer for the men, you've had the bag, and that loving person, your partner's still there for you, that's love. That's not just attraction or sex. And so any sexuality may be gentler, may be more loving even, and yet they're still there. It may not be as often. We were in a palliative care situation. We were talking about just tenderness and, you know, things, and she lost her cool with it. She said, how dare you presume that I'm not going to be full on sexually? I want my husband to remember me. And we thought, whoa, you know, back off, you know, and we did. We made a judgment. What we'd not done was ask. And after that, we never forgot. At a conference where these European oncologists were all boasting about how they were able to give Viagra. And I said, did you talk to the wives? That's where the oncologists should have had some sexuality education, where they could have eased it in with the couple. You know, not just, oh, this is the man and he needs this. I think that's what people don't realise. Sexuality really isn't as much an individual thing. Often it's a partner, and so it's important that we think of that if we're talking to people about sex. And I think maybe if you make it a conversation, okay, you have the examination, build in, like say, a 10 or 15-minute conversational bit of the consultation. You've already done the form, so you know what they were embarrassed about. You've done the examination, and then have the conversational. Say, how are you going? You know, what's happening in the bedroom, even if you don't want to say sex, you know, or what's happening with your partner. You know, how have you found, what's difficult since you had the surgery, or are you finding the tablets are making things difficult for you? I can offer you lube, you know, I can offer you pills, I can offer you information. What's to be scared of? What can't you talk about? You know, don't internalize it. When your patient's asking you sexuality questions, they're not coming on to you. Sure, I've had doctors, you know, be fearful that if they're talking about sex with women, that the women may come on to them, or vice versa. They're not coming on to you. If you feel that, have your nurse sit in. You know, if you offer help to someone, they know you're coming from a place of care. Why are you a health professional? Because you care about people. Know that as a health professional, you're really important. You're going to show people who are at a loss. You're going to show them how to make their life better.